Alrighty, it's 11:02, so let's get started today. We have decided that we'll be just doing in the future the regional all-member call. Figured that we get a lot of the same people at who are in the lead call in the member call, and so we thought this would work out a little bit better for us. And going forward, we'll have 4 quarterly meetings. The next one in July on the 26th also. We'll talk about that in just a little bit, and we'll go from there. So welcome, everybody. Glad to see you. Thank you for being a part of Mountain Pacific and what we're doing here. If you have any questions along the way, please enter those in the chat box. Mute your microphones during presentations. And towards the end of this, we're going to ask you to share your experiences with the group as we go forward. So please enter the following information into the chat: your name, your organization, your coalition name and location, and activities and or updates that you may have. And go ahead and do that now. While you're doing that, we had a few different little pulse checks that we wanted to get in with you. So for your regular meetings, and as you're looking at these going forward, how can Mountain Pacific Quality Health support you? Does anybody have anything they'd like to talk about regarding the regular meetings and our support right now? You can go ahead and put that into chat also. And while you're thinking about that, you could also identify metrics and data, the 3 most important areas of focus in your community. As part of our housekeeping going forward, want to make sure that we can update member names and contact information. And we will be looking at a new recruitment period coming up. The contract modification negotiation for Mod 2 is underway. Normally that takes about 30 days. So we'll probably be looking at a final contract modification late May, early June, and then we'll be able to understand more. From that point, we will have a set amount of time to actually get out there and to recruit new partners. So now's a good time to start thinking about additional or potential partners and who we might recruit and how we might get started working on that. And also some other paperwork. Make sure you have coalition participation agreements. If you have a charter, we're going to change those for 2022 going forward with the mod. And our all-member meeting is on July 26th, 2022. Any questions so far? Great. Okay, so our 5 goals for community coalitions. We're looking at goal number 1 is opioids, adverse drug events, and reducing deaths. We're going to target across the region chronic disease management, which is goal number 2. And we're starting to set up teams that will be working on these different goals. And we'll also be working with other members of Mountain Pacific who are not just a part of the Task Order 1 contract, but that are also working on some of the other contracts in our states. And we'll try to work together as a team to help manage chronic disease and how we go about providing care and services for it. Goal number 3 is care coordination. Emergency preparedness plans are goal number 4. And we will have a bunch of resources tagged on to the notes for this meeting today. And we'll be sharing that one note with everyone once we've had a chance to go back through the recording and adding notes to that before we send it out. And then last but not least are immunizations. So as I mentioned, we are now in the negotiation phase. We've waited an awfully long time for modification number 2 to the TO1 contract. It has dropped the negotiation phase. We are completing our response to that. We should have everything done by the beginning of May. And then from there, we'll be looking at the time it takes to negotiate those back and forth between Medicare, CMS, and we'll know more a little bit later after that. Then we'll talk about a few of the other types of general updates that we have as we go through it. But we want to start off right away with our pharmacist, Kyla Newland, and she wants to talk a little bit about some adult vaccinations going forward. So take it away, Kyla. Let me know when you need me to advance the slide.
Thank you, Mark. Thank you, everybody, for attending today. So the recommendations for pneumonia recently changed, and the reason for this is not because we have identified folks that are at higher risk for pneumonia, but there's 2 new pneumonia vaccines that were approved on the market. So the CDC has incorporated those into their recommendations for, I'm going to go over adults today, high-risk adults, those 65 and older, and those at higher risk of having pneumococcal disease. So we have quite a few folks that would qualify in that less than 65 area, including folks with diabetes, anybody that has chronic heart disease, liver disease, lung disease, so COPD and asthma. So this could potentially be a large group of patients that you might be working with in your communities. Next slide, please, Mark.
Oops. This one?
Yep.
Yeah.
So this is just a nice chart. It shows all the available pneumonia vaccines. Previously, we only had the first 2 columns, the PPSV23 and the Prevnar 13, PCV13. And the 2 newly approved ones are PCV15 and PCV20. So you may wonder why are 2 new vaccines approved. They are from different manufacturers. So just to add a little bit of confusion to our schedule, we have 2 new products to keep track of. But as a general standard, your PCV20 is going to be kind of the gold standard moving forward for high-risk adults for vaccination. Where it gets a little bit tricky is when you look at folks that might be midstream in their pneumonia vaccine series. And so I will provide a couple of resources that will help you figure out which vaccine is most appropriate for your patient. And I will also note that the PCV13 is the only vaccine currently approved for children, but this could change, and it is maybe anticipated that the Prevnar 20 might replace the Prevnar 13 for our pediatric population. Next slide, please. So this is moving on to shingles vaccine. I just wanted to give a quick update on this as well, but just talking more about the pneumonia, and on my next slide, I've got some really good resources that you can use. There's a desktop application where you can put in all your patients' information, and it'll tell you which vaccine is most appropriate for them in which schedule. There's also an application you can get on your phone that I've actually used quite a bit already and is very handy to figure out which pneumonia vaccine is needed. Mark, can I share my screen for a minute? I also wanted to show a handout and give a link for that.
Yep, there you go.
Let's see here. Okay, so are you seeing the pneumonia vaccine timing for adults?
Yes. Okay,
so this is a 4-page document. It actually looks very confusing when you first look at it, but it's not as complicated as it looks, but it's a nice resource that you can use if you do not have access to either a computer to use the application, which is called Pneumorex Vax. And that is also included in the resource slide. And this basically tells you kind of the folks that haven't gotten any pneumonia vaccine, and then it goes on and the process of on page 2 and 3 to tell you what to do if they're kind of mid-cycle in their pneumonia vaccine series. So let's see, I will stop sharing. And go back to our update on shingles vaccine, which I just briefly wanted to mention. They did update the adult shingles vaccine recommendations recently as well. That vaccine is a 2-dose series. It used to be approved or recommended for folks 50 and older, but they reduced that age range for folks that might be immunocompromised down to 19 years and older. So your patients that are in this higher risk group may have deficiencies or immunocompromising conditions are eligible now to get the 2-dose shingles vaccine, which is given 2 to 6 months apart. Next slide, please. And I believe that should be the resources links to the, oh, yeah, here we go. Links to that app that I mentioned, and then the handout, and then there's also some web-based trainings on the CDC website for all vaccines if you want to kind of get yourself up to date on what the recommendations are. So I think that's all I had.
Excellent. Thank you, Kyla. We wanted to do a couple of polling questions at this time. So what areas of quality improvement are you currently working on in your coalitions? Opioid best practices, A, medication, safety, adverse drug events, B, admissions, readmissions, nursing home quality, D, emergency management, E, immunizations, F, or chronic care management, G. Please go ahead and fill that out. Okay. Everybody had a chance to put something in there. Looks like, hold on. Looks like chronic disease management, admissions, readmissions, and nursing home quality are areas we're all looking at. That's great. Okay. Let's move on to our second poll. And our second polling question is, in what areas of quality improvement do you need additional support? And we're following the same goals that we mentioned before. A, opioid best practices, B, medication safety, adverse drugs. Admissions, readmissions, nursing home quality, emergency management, immunizations, and chronic care. And yes, emergency management, as we mentioned, we've got a lot of resources for you that we'll be sending out after this meeting. And we'll be able to take a look at that. Chronic disease management, we're happy to see a lot of people looking at that too. So we will be, as I mentioned to you before, looking at chronic disease management from a regional perspective, and hopefully have a lot more options and optional perspectives for everybody so that we can work quite a bit on that. Okay. Great. All right, Mary, let's move on then. Can everybody see my slide? All right, well, we're very happy to have our team from Guam with us today. And Guam recently did a wonderful project, what they called an alert day drive-through mini fair. And I see Agnes is on. Agnes, you ready to take it away?
Okay, so we had an alert day drive-through mini fair. If you look at that, it says drive-through mini fair. We had to come up with something to address, managing chronic disease in a creative way with a pandemic. And around this time on Guam, when we were planning it in February, we were still battling the Omicron variant here in our community. And we still had a lot of restrictions, wearing the mask, the distancing. You couldn't gather more than 100 people outside. So we decided to do something like this, a drive-through mini fair. So just a quick description, what we had, we just reserved a section of a big park there, and one of their big parking lots, and people would drive through to different stations to get information about their about how they can manage their diabetes. And we combined this with the American Diabetes Association annual diabetes alert day, and that is usually held in March, the last Tuesday in March. So during this time, the ADA, at the American Diabetes Association, encourages people to take this risk test to see what their risk is for developing diabetes. So that was the whole idea, for people to be more aware of their risk for diabetes. So in the first station that we had there, we set up canopies in the parking lot, and people would have to drive through these canopies to get the information. So we would give them the American Diabetes Association, their risk assessment. And it consists of, you can forward that, Mark. I just wanted to show them the questions asked in this risk assessment. So if you can forward that, the next one.
Next slide.
Yeah, the next slide. So this was the screening questions. How old are you? What is your gender? It takes less than a minute, and then we score it. If you score more than 5, you're at high risk. And then you had an option to go to the next station, which was a screening station. And we joined up with the Guam Diabetes Association, and they did the screening for blood sugar and blood pressure. If they opted to go to that station, they would have to park and then come out, and then we had things set up. And then the third station we had was a consultation station. So we, under one tent, we managed to get 2 physicians, an endocrinologist and an internal med doc. We had 2 certified diabetes care and education specialists. We had a social worker, 4 from the Department of Public Health. We had one of the assistant professors in nutrition from the University of Guam, who's also a registered dietitian. And we also had a pharmacist, all under one tent. So, and this is all free. We had advertised all week before our event, which took place on a Saturday. We were on all the radio stations on Guam, and we got interviews with them as well. We shared it on social media because we developed our own flyers. If you go back, well, I just want to say we had so many volunteers. I mean, we had over 100 volunteers. We had volunteers from the University of Guam, the internship program, which helped us. We had the Lions Club. We had like 15 clubs from Lions Club help us. We had the National Guard, because we offered a vaccine station there for COVID. So we had the National Guard help us direct traffic. We had, who else did we have? Glynis, who else did we have there? We had the Guam Mariananas training.
nursing
Yeah.
assistant students, so they did the risk assessment from the
They did.
Guamayanas Training Center where I
Right.
work.
And the Lions Club had their, they just got in their mobile van, so that mobile clinic, so that was on display. So that's why they were very active with us. We invited, we had 9 people that we invited, organizations that were the insurance companies. We had some foundation, a big supermarket here has a foundation. We invited them. So we had 112. If you go back, Mark, can you go to the previous, I just want to show how many people went through. No, the next, yeah. So we had over 100 volunteers, but we only did, well, we did 100 risk assessments. So actual people that came through that first station did those diabetes risk assessment, and those that opted to get screened for their blood pressure and blood sugar, we had 58, and then we had 33 health professional consults. So this was just the range of our blood sugar and blood pressure, but I have a scatter plot with more of the blood sugar and blood pressure data. So if you go forward, Mark, okay, so these were the screen questions. So we did 100 people came through, and 67% of 67 of the 100 people scored in the high risk category. So that's pretty, I mean, that's pretty significant. They didn't know that, they had diabetes. So I'm glad that at least 58 came down and got checked. Can you go to the next one, Mark? So this is the, when we did the screening, this is the scatter plot. I have there, if you see the red lines, that's a 120/80. That's the, that's the recommended blood pressure just for the general community for, irregardless of if you have diabetes or whatever, you should be less than 120/80. If you notice, a lot of the points are not within that region. So that shows that, well, many of them, are probably, maybe they didn't even know they had, they might be at, hypertensive. So we found this very interesting. And then the blood sugar one, Mark, we did random blood sugars. If you forward that slide, the highest was like 400 plus. I'm glad we had a social worker there. I'm not too sure if this person was probably referred to, of course, and we had the physicians there, and they were seen. So most of them, if you notice with this graph here, the highest, that most of them fell between 97 to 140. That's the range. So these are random blood sugars. So we don't know if they have diabetes or pre-diabetes, or if they have diabetes, if they're on medication. But this is just random blood sugars. I don't know how we, what other, we still have to think about this and see how we can, what information we can glean from some of these results. But this is the range that we had as far as the random blood sugars were concerned. Is there a next slide there, Mark? Okay, so that's the blood pressure one. Okay, so those were just the results that I wanted to show you. It took a lot of effort and with our community to pull this off. We had the governor come down, and it's an election year, so we had her opponent come down as well and get checked and talk to everybody. It was a lot of fun working with these small groups. And in our post-event meeting, we came up with a lot of very creative ways to address this next year, because we do want to join forces with the Lions Club and all our partners next year. Maybe not in this kind of venue, but certainly doing something, some kind of screening project. So we did, to address on the chat, I think, Crystal, how many, we had 100 people actually take the risk assessment, and then we had 58 people do the screening, and then 33 people went and got the consultations. So that's our numbers, but we had about 112 volunteers altogether that day. So we're just trying to, we had, it we had the Lions Club stand in a very busy corner in the intersection right next to the, close to our parking lot, close to where the venue was, and they had what they call the diabetes wave. They had made big signs, take care of your diabetes, eat healthy, all those kinds of messages, and they were holding it up there and waving. I don't have pictures, but maybe the next one we can do. So that's what we did for our Diabetes Alert Day, and it just got some momentum going, and that was a good thing. And as a community, it was a good way to get people together. It's an incredible how people just donated. They donated snacks for the volunteers, and they set up canopies, and it was a lot of fun. I wish there were more people that came through. So that's something that we have to think about next year, how we're going to do this again. But at least we have a group of people that enjoy doing this. So thank you very much.
Got some information in chat there, Aggie. Very well done from Dave and Kyla. Following the diabetes screening, did the coalition prepare any type of final report describing or prepare any type of final report describing the process used and the findings?
No, we don't have an actual document. We just got together and we wrote out notes, and but because we're the core team, but Dave, that's a good idea. I'll write that falls on me, so I'll write the final report there. It was, like I said, it was a lot of fun. We involved the University of Guam interns. They were really instrumental. Those students they're just full of energy, creative, and they just know how to do a lot of things, get things going. And of course, our contacts in the community got us, donations of like posters and whatnot, and the space, even the space, it was good. And the National Guard, when they told me, okay, the Guard is going to be here, I asked one of the people, why is the Guard going to be there? Oh, because we're giving vaccinations. That just popped up, and I said, okay, that's fine, more the merrier. So, and it was good because they helped direct traffic, and no one would fool around with a guy in fatigues as opposed to someone looking like me. So it was a lot of fun. We just didn't anticipate a big surge of rainfall there and strong wind, because it was right near the ocean. The parking lot is right near the ocean. So we definitely have to find a new venue so we don't get rained on. But
I think coming month, there will be another health fair, but it's going to be held at the mall since we are easing out the restrictions. So the Filipino community of Guam will be having an outreach or health fair, I think this month, Aggie, and also the foundation of former Senator Dennis Rodriguez, the Todo Guam, will also be having health fair. So we will be participating in those. We are always invited.
One of the good things that came out of this in the post-event meeting was data. They saw these numbers and how it was kind of presented, and so they said, okay, well, perhaps we should have a standardized health fair form to collect information. Then we have to figure out how we're going to store this. And this is something Glynis and I have been working with the coalition for a long time. So it's just like, oh, thank goodness. So now we have a committee with the usual people to come up with a form, but we'll involve some of the territorial epidemiologists who would be happy to take a look at our stuff and show us how we can, what kind of information would be helpful. So that would be great, because there's so many health fairs on the island. And if this is a form that's available from public health, I think people would take advantage of this form, this, screening form. That's what we're supposed to come up for every health fair. And then, of course, where we're going to store it and how we're going to do that, all that information. So we're working on.
There's a question here about the follow-up for those at high risk. We don't gather names, so we don't have a concrete procedure of follow-up, what we tell those people who are high risk, we tell them to follow up with their primary physicians. If they don't have primary physicians, then we try and help them get one. Guam is such a small island, so we know most of the providers, but following up for each and every one of those who are high risk, we don't have that capability.
And thank you, Danielle, for that question. Nice to see you. Always nice to see you at these meetings. Barb had a little comment there. Very nice job. Great opportunities for people in different locations and populations. And Dave, do you want to come off and talk a little bit about what you'd like to do here?
Well, I appreciate all the work that's gone into what they did in Guam, and I would like to know a little bit more about the process of organizing such an undertaking. We have two adjacent Indian reservations here in the area that are plagued with high cholesterol, diabetes, you name it. And I think there's some applications from the Guam experience that would be transferable. So anything you can send without preparing anything just for me would be much appreciated, Agnes.
Okay. So I think a brief report of Dave and who was involved and you know the outcomes. I think that I'll send that your way. I'll share that with you.
If I may add also another way of reaching people outside of private clinics or the mall is at the grocery stores. So last Saturday, the Guam Diabetes Association, we did have an outreach at one of the big groceries here, Costuless. So we were there, but we don't have that big procedure like what we did with the diabetes alert. So we only check blood pressure, blood sugar, and some teachings. And this Sunday, we're doing another one with the St. Paul's Assembly of God. It's a church because we wanted to use all the strips that we have because they are expiring. We don't want to waste the glucose strips that we bought. So we're doing another one this Sunday, the Guam Diabetes Association.
Good for you. Good for you.
Thank
All right,
you.
so these are these different wonderful work that people are doing in coalitions all across our region. We'll have another meeting, like we said, in July. Anything that comes up between now and then, please let us know, and we'll get you on the agenda so you can report out how you're doing. That's wonderful work, and we love the territories and all the hard work they've been doing, particularly in chronic disease management. So, good deal. Before we get into our individual challenges, I just wanted to ask Jill if, Jill, did you have anything for nursing homes today?
Thanks, Mark. Yeah, let me get my camera turned on here. Hi, there we go. Thanks, Mark, for asking me to join your call today. Really, in the nursing home world, we're easing out of what we've come to know as the normal now with COVID, and so we're working on transitioning out of that era into a time that's post-pandemic, if you will, or maybe the new normal. And so a lot of our efforts now are beginning to be concentrated on how to support the nursing homes, as a lot of these emergency pandemic waivers are coming to a sunset. There have been some waivers in place for physician visits, for staffing, bringing people into a facility that have not yet been trained as a certified nursing assistant, and some other licensure strategies that were very helpful during the pandemic. And so a lot of our nursing home work is just really trying to focus on how to safely transition out of that time, knowing that there could still be variants and could still be COVID cases. And we know our population in the nursing home is most vulnerable to that. So we're continuing to spin that plate and adding a few others to our menu. that's kind of really what we're focused on, Mark, as far as the nursing home work. I would entertain any questions anybody might have.
Thanks, Jill. We appreciate it. And obviously the coalition work with nursing homes that are part of that and participate in our coalitions are aligned with our other measures that we work with the nursing home too. So thank you so much.
You're welcome. Thank you.
Yeah, any other questions? All right, and Ray, our data guru. Ray, do you have anything that you wanted to talk about today?
Just real quick, I've just got two things I'd like to talk about. First is that contract modification that Mark mentioned earlier. Again, we're back into preparing data for our baseline rates, and as soon as we have data available at the coalition level, we're going to give that out to our account managers, and they'll be able to share it with specific community coalitions. And also, we've been able to get some of our original 12 mod measures out there. We've got some community rates out to our account managers. And so hopefully they'll be able to identify some of the alignments between our measures and what you guys are working on at the community coalition level. And hopefully have some more insight as to where they can help out best and improve not only our outcomes for our measures, but also just general well-being in your coalitions. So that's all I've got right now.
Terrific. Thanks, Ray. Okay, so where we're at now is this is the interactive portion. So please get involved with us today. We're looking at what are you doing in your coalition, challenges, interventions, outcomes, or bright spots. Does anybody have anything they'd like to share with us today?
Sure. Hi, this is Renee from Anchorage, Alaska, from the university. We just had a super quick, just a few pictures to kind of brighten our day. If you don't mind if I could share the screen, would that be okay?
Yes, you can. Thank you,
Perfect.
Renee.
No problem. Okay. And so the students at the Alaska Pharmacists Association, at the University of Alaska, Anchorage, Idaho State University, cross campus College of Pharmacy, ended up participating in a health and wellness expo. And so we were really excited. They usually do a number of outreaches. However, with COVID, we've been challenged just like everybody else, as far as if it's not related to immunizations, we haven't necessarily been allowed to or able to do that. And so, so what we did was actually last minute put together kind of an Operation Heart and Diabetes outreach initiative, in which we ended up doing screenings for blood pressure, cholesterol, hemoglobin A1C, as well as kind of looking at kind of basic health screenings for OTC management as well. And brought the students in. And so they screened 117 patients in 2 days, in 2 partial days. And since it was primarily a women's health initiative, you'll see that there's a little bit of a disparity between females and male patients that we ended up seeing. And a number of them already had conditions, and then we ended up doing some education on kind of current management, maybe non-optimal management. Also screened and found a number of individuals who we've sent for further follow-up with their primary care providers with all their numbers, so that they'd be able to go to them to kind of get additional kind of follow-up. And so just a few little kind of pictures. We had everyone from P1s, which are our first year pharmacy students, to P4, which are in their 4th year, just about to graduate next week, doing some of the screening initiatives. And so that was really something that I was pretty proud of, as far as kind of what we were able to do within a week and a half period that we found that this was going to be something that we were allowed to do. So just a quick little shout out to our students. And I know that you've probably seen a bunch from Kyla's that the students have also been pretty integrally involved in the diabetes and heart disease coalitions for the state. And then we've been kind of working with them also to help develop materials for the Alaska Virtual Health Fair website, in which Kyla will kind of show a few of those screens that is really kind of helping to bridge that gap when we can't actually work with, touch, and talk to patients directly. And so that's my little happy share of students.
Thank you so much, Renee, for sharing.
Yeah,
I have the pleasure of working with Dr. Robinson on multiple initiatives, and they're doing great work in Alaska at the School of Pharmacy. I can share that virtual health website also if you folks are interested in seeing it. We basically update this every month, and it's kind of just focusing on one or two topics and putting some nice visuals on there. And this is a source that folks can get information. And it did start up in the middle of the pandemic when we saw our local health fairs that had previously distributed this information, not doing in-person events. And we thought that it was a gap that we potentially needed to fill. And now we're just continuing to do it and kind of having the online presence in addition to the health fairs that they've kind of started back up. So you can see this month we focused on stress awareness and had a nice little flyer for folks. So I will put this in chat if you want to explore a little bit further. But it's been kind of a fun project and really just continues to build, and we're looking to really expand it and reach more patients. So if there are avenues that you have for suggestions as far as distributing this information, we would be happy to hear about that.
And we have a number of partners. I don't know if all the partners on there that we've worked with the Alaska Black Caucus, and they've also been some of our partners for some of the outreach initiatives as well. And so the Diabetes Association within Alaska, the Take Heart and the American Heart Association, the Alaska chapter, Ladies First, as well as some of the tribal and kind of various kind of health partners across the state. And you see Mountain Pacific there too. Just wanted to highlight.
Yeah.
Thank you.
Yes, thank you so much. That's great. And you put that link in, huh? The chat?
Yeah, I'll put it in the chat.
Great.
Thanks.
Perfect. Okay, can we'll stop screen sharing.
Yep.
There we go. Okay. Anyone else? Well, this has been great. Two great projects today, and it looks like we're already getting into sharing and spreading and scaling as Guam and Dave might be working together there for billing. So that's great. Anybody else have any other topics on the challenges, interventions, outcomes, or bright spots?
I can give you a future initiative. So this will be in fall, and we're already starting to plan this. So we have our first meeting coming up next week for the Prince William Sound initiative, where we go out to Chinega and to Titlik and do a number of health screenings, both within the community as well as at the school. And then we also do a number of like health education kind of initiatives within the school. And so that will be in the fall, likely in September, usually the third week in September. And so as we're starting to plan that, we'll kind of continue to keep you posted, but our first meeting is coming up next week.
Terrific.
Hey, Mark, this is Crystal, and I can share what Wyoming is up to.
Great. That'd be wonderful.
We are starting, so our coalitions are doing a beta test for CDC's Infection Prevention Project First Line, and we developed an escape room. And so we are mentioning this through our coalitions and, hey, who wants to be our beta testers? And so we've got a couple of people lined up to do this before CDC actually approves our escape room. And again, we are encouraging non-clinical people to be paired with clinicians. So I'll teach, I'll learn type of thing. And so I'll love to report out in July on how we're doing. So I just wanted to let you know that what we're up to in Wyoming.
Terrific. Thank you very much, Crystal.
Yeah.
Okay, anybody else? A lot of bright spots today. Okay, so upcoming events from Mountain Pacific. Our next regional coalition all-member quarterly call will be on July 26th. You do need to register for that call, so please get in there and take care of that. April 30th is National Prescription Drug Take Back Day. And there's a link in here for you to take a look at that. May 6th and May 20th, there are opioid risk assessments, Eating the Elephant One Bite at a Time, another educational opportunity Mountain Pacific is part of to put out there. And then we have Nursing Home Echoes. The Geriatric Workforce Enhancement Team is putting them on the second Tuesday of every month. For anybody who's interested in that, you can register with that link. And then the really terrific and well-attended weekly series that the nursing home team and Mountain Pacific has been putting out. It's Worth a Shot series. If you haven't been to it, it's been very, 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 very helpful. So if you have a chance, go ahead and sign up for that. So if there's any other questions, now's a good time. And if not, we're grateful to all of you for all you do for the communities that you work in. We're proud to work with you and to be a part of all the work you do. So until next time, we'll check in with you on the 26th of July in Guam and Saipan. That's the 27th. So a lot of different time zones for us. So any other questions, please just address them to us. We'll take care of it. We are so grateful, like I said, that you're in our lives. So we'll catch you then next time.
Thank you. Bye.
Yep, thank you very much.
Thanks, everyone.
Thank
Bye.
you.
Bye. Thanks, Mark.
Yep.
Thank you. Yes,
Thank
thank
Thank you,
you.
Mark.
You're welcome.
Take care.
Bye, Nancy. Nice to see you.
Nice to see you.
Yes.